Hey everyone, welcome to today's webinar. I'm Judy, the Executive Director of F.E.A.S.T, and we're just going to give it a few more seconds so that people can come in from the waiting room. Okay, so again, welcome to today's webinar on supporting without stigma, helping loved ones heal from binge eating disorder. We're really thrilled that Carrie-Ann is here with us today, and it's going to be a great presentation. I would just like to remind everyone that your cameras and your microphones are currently off. They need to stay off during the duration of the webinar. If you have questions during the presentation, and I hope that you do, you can just put them in the chat box. And at the end of the webinar, then Jenny Gaines, who is our Director of Programs and Services, is going to moderate the Q&A session. So all your questions will be answered at the end of the webinar. And I know that someone is going to ask whether we are going to have access to the slides after the webinar. So I'm just going to answer that now and say that Carrie-Ann has generously offered to put together a handout based on her slides. So the handout will be available after the webinar, which is effectively the same thing as the slides. So without further ado, let's get started.
Right. Just get my slides up. Okay, hi everyone. So thank you, Judy, for the introduction. My name is Carrie-Ann Doriano, and I am a licensed professional counselor. I'm specializing in working with clients with binge eating disorder. So today we're going to be talking about ways to help your loved ones heal from binge eating disorder. And while we go through the presentation, I just want to remind you all and thank you all for being here today and for seeking help and guidance in how to help support your loved ones. And just as a reminder, in this presentation, I'm going to go through some maybe like do's and don'ts. And we're also going to be talking a lot about compassion. So I'd love for you all to have some compassion for yourself throughout this conversation and presentation. There might be some things that you're doing that I might recommend to not do, and that's okay. You're here to learn and to figure out different ways to help support. So our objectives for today are to help identify specific and caregiver and loved ones interventions for binge eating disorder. Also to help define how weight stigma and anti-fat bias plays a role in the treatment of binge eating disorder and the importance of a weight neutral approach. And you'll come away from this presentation understanding the benefits of a weight neutral approach and also having some specific examples of ways that you can provide a nurturing environment for recovery for your loved ones. So, what is binge eating disorder? According to the DSM, which is the diagnostic criteria, an episode of binge eating is characterized by both eating in a discrete period of time, an amount of food that is definitely larger than most people would eat in a similar period of time under similar circumstances, and a sense of lack of control over eating. It also includes three or more of the following. So it could be eating more rapidly than normal, eating until uncomfortably full, eating large amounts of food when not feeling physically hungry, eating alone because of being embarrassed by how much one is eating, feeling disgusted by how much one is eating, feeling disgusted with oneself, depressed, or very guilty after overeating. So I think like this, we want to be mindful of this diagnostic criteria and how it is pretty vague. So especially the first one, eating something that's definitely larger than what most people would eat in a similar period of time under similar circumstances. What does that really mean? I really like to look at it more of like the sense of lack of control over eating, and especially like the three or more criteria. I also think it's important to note that part of binge eating disorder, the diagnostic criteria says that it's not with regular use of inappropriate compensatory behavior. And I also think that that is very vague as well. As we'll go through this presentation, I'm going to talk about how restriction plays a role in binge eating. So it's important to think about, is that something that your loved one's engaging in? And is it something that could their binge eating be explained by restriction? There are also other eating disorders with binge eating symptoms. So it's not just binge eating disorder. It could also be anorexia or atypical anorexia nervosa with binge purge type. bulimia nervosa, or even OSFED. So your loved one might not be diagnosed with binge eating disorder, but they could be engaging in binge eating. So I'm not going to bore you with too many stats, but just want to, I think I put in some that are really important to talk about. The most important thing is that binge eating disorder is more common than bulimia nervosa or anorexia nervosa. It's actually the most common eating disorder, and it is one that does not get as much attention. So I think that's why this presentation is so important and other presentations like this. It's also important to note that 40% of people with binge eating disorder are men, and up to 2/3 of individuals with binge eating disorder live in a larger body. And so this just highlights how the stereotypical view of what people who have eating disorders are not actually the case. So most people with eating disorders do not live in smaller bodies, and they aren't always um, thin white females too. Um, when you're thinking about caring for your loved ones, we want to also make sure that we're keeping in mind that most people with binge eating disorder also meet diagnostic criteria for another psychiatric disorder. So just being mindful of their mental health as a whole and how binge eating can cause considerable functional impairment and poor quality of life. So it is something that affects people in many different ways. I think it's important to note that people who have food insecurity, so people who might not be able to pay for food or who rely on benefits for food, also report higher levels of binge eating than people who do have food security. And I think this is important to note because it's a reminder that restriction in any way, so food insecurity isn't intentional restriction, but they might not have enough food, that can cause their body to go into um, binge eating when they do get food or do have access to food again. So why is binge eating disorder undetected, undiagnosed, and untreated? Um, the biggest thing is that it was just diagnosed, which was just added to the DSM in 2013. So it's one of the more newer diagnoses in the DSM. It's also We've also found that most people don't have treatment and don't have an accurate diagnosis for at least 10 years after their first symptom of binge eating. And this can be because there's a lot of shame and stigma around binge eating, especially for men and for people of color. And that goes with any eating disorder. Like I mentioned earlier, this view of what eating disorders look like isn't actually the case. And we can help these people get care by increasing knowledge about it. So that's like how there's low levels of public and personal awareness of binge eating disorder. And on top of that, most people with binge eating disorder are presenting to healthcare facilities or treatment for help with weight loss. And so that is just going to delay treatment and to increase symptomology. There's also a lot of misconceptions and misinformation among healthcare professionals in understanding binge eating disorder. A lot, like I mentioned, a lot of times people will be met with weight loss advice rather than understanding that binge eating is an eating disorder and how to address that. So, what is the binge restrict cycle? It's something I mentioned a little bit, and we're going to go into some explanations of it. So, the first thing I'd like to ask for you all to do is just think about being told that you can't eat your favorite food ever again. So, you can never have whatever it is. It could be ice cream, it could be pizza, it could be bananas. You never eat it again. And so, what would you do today? Most people would eat that food tonight, whether they were hungry for it or not. And they would also probably eat more than they're hungry for. And so this is just a reminder that this idea of deprivation, so this thought process that you can't have a certain food, is going to set your body up to engage in binge eating. In the 1940s, they did a study about the effects of semi-starvation. So this is called the Minnesota Starvation Study. And so these men were put on a 6-month diet, and it was adequate in vitamins, minerals, and proteins, but it was it was their caloric intake was similar to what diets mainly prescribe today. So these men ended up losing 25% of their body weight, and they experienced profound personality changes. So they became lethargic, they became irritable, distracted, apathetic, and depressed. They also became preoccupied with food. So a lot of them were talking about food morning, afternoon, and night. They were looking up cookbooks, they were writing down recipes, um, just really obsessed with food. But then when the food restriction was lifted, they entered this refeeding portion of the experiment. And during this time, they were allowed to eat whatever they wanted. And all of the men engaged in binge eating for weeks and continued to feel ravenous, even though they were allowed to eat what they want. It wasn't until they were weight restored that they were able to have their energy and emotion stability back. So this is a reminder that binge eating is a natural response to unmet needs. So your loved ones may feel like when they're restricting food that they're in control, and but this will just set themselves up to engage in binge eating later. It's a natural response to unmet needs. Those are physical, emotional, or psychological. It's also important to note that restriction does cause muscle loss, which impacts people's heart, digestive system, and other major organs. And our bodies don't know the difference between restriction or dieting and a famine. So when this happens, our bodies will go on high alert and it will slow down metabolism. So this again sets someone up to engage in binge eating because their body wants the food and needs the food to function. So it's not mind over matter, and it's not because of willpower. So most binge episodes are triggered by being under-resourced in one or more ways. So this could be physical deprivation. It could be due to skipping meals, under eating, or dieting that leaves someone's body desperate for nourishment. It could be due to emotional overload, which could be stress, loneliness, anger, grief, or other strong emotions can trigger binge eating as a coping mechanism. It could be also due to mental exhaustion. Someone might be perfectionism, they might have a lot of self-criticism and have a lot of decisions to make during the day, and this can wear them down and making binges more likely. So again, binging is not about losing control. It's trying to meet an unmet need as best as they can in the moment. And we're going to go through a little bit about how you can help your loved ones when they are experiencing these things. Okay, so this is the binge restrict cycle. So it starts with restriction. So your loved one might be telling themselves that they need to be good, they need to eat less, they need to avoid certain foods. Someone might be telling them to do these things too. And that when that happens, their body goes into deprivation and it feels starved. And this, like I mentioned, could be physically or emotionally. So they could be actively restricting and their body physically needs more food, or they can even emotionally be really stressed about certain foods when they are eating them, and that could also be a form of deprivation. Eventually, their body is going to rebel against the deprivation, and that's when they engage in binge eating. And then afterwards, that's when the guilt and shame sets in. And your loved one might resolve to restrict even harder next time, or to be better next time, or to have more willpower next time. But then the cycle just keeps going over and over again. So, what can we do when this happens? We can help break the cycle. And where that comes in is especially breaking the shame component of it and responding to it with self-compassion instead. So shame thrives in secrecy, silence, and judgment. And so how we can help our loved ones is to come in with help modeling self-compassion and help them build self-compassion. So Kristen Neff does a lot of research around this, and I'm going to go through some examples of ways that you can provide compassion for your loved ones and help them build up self-compassion for themselves. So the first component of it is self-kindness versus self-judgment. So self-kindness means being gentle, understanding, and supportive towards yourself when you're suffering, struggling, or feel like you failed, instead of harshly criticizing or punishing yourself. So you may hear your loved one say something like, I have no control, or I ruined everything, or I'll never get better. That's self-judgment. So self-kindness can invite a new response. And that could look like, I had a hard moment. I was coping the best I could. I can respond with care instead of punishment. So this will help break the shame binge cycle, which is often triggered by even more internal criticism. So where you can come in is you can even model that self-compassion by saying things very similar to what I just said, but in a different way of like, it sounds like you had a hard moment. You were just coping the best that you could. How can I help you right now with some self-care? The other component is common humanity versus isolation. So, common humanity is the recognition that suffering, imperfection, and personal struggles are part of the shared human experience. It's not something that isolates or alienates us. So, we are not the only person that suffers. A lot of people and your loved ones might believe that they're uniquely broken or feel deep shame about their eating behaviors. And helping them recognize that they're not alone can help reduce shame and build connection. So, this can help decrease their urges to isolate after a binge and opening the door to more support, community, and compassion. So, for you as a loved one, it can come in helping breaking that isolation, reminding them that they're not alone, spending time with them, doing things that they love, helping them feel safe being with you. The third component is mindfulness versus over-identification. So mindfulness in this context means holding your thoughts and feelings in a balanced awareness. So this is observing them without exaggerating or suppressing them. So for your loved ones, binge urges or post binge guilt can feel really overwhelming and all-consuming. But if they can develop some mindfulness about it, that can be helpful for them to just observe their experience rather than becoming fused with it. So, for example, your loved one might say something like, I'm feeling I am out of control. And that is over identification. I'm out of control. Mindfulness would be something like, I'm feeling the urge to binge right now. So as a loved one, you can come in and help them label their experience. And we're going to go through validation a little bit later in the presentation, but that can look like it looks like you're having the urge to binge right now. How can I help? We want to make sure that we're coming in with self-compassion and compassion to be the interrupting force to break the binge restrict cycle, because self-judgment, isolation, and over-identification is just going to keep them engaging in binge eating. Another way that you can help your loved one is thinking about what types of binge eating are they engaging in and helping them explore that as well. So you want to help your loved one be able to pause and reflect on what they really need or what they're looking for in the moment. And this might not happen in the moment right before they engage in a binge. This could happen afterwards when they're processing it or talking about it with you. Then you might recognize that your loved one might engage in one or two of these types of binge eating, or they might engage in all of them. It's really person to person. But a hunger or deprivation type of a binge is when someone has physical hunger over under eating, restriction, or dieting, and this sends their hunger into overdrive. So kind of like the binge restrict cycle that I talked about earlier. It could be that they're feeling emotionally deprived of certain food, or where the good food, bad food can come in. There also can be a stress binge where it's used as a way to manage or improve someone's mood, to help them unwind or relax, or to help them avoid or distract. This is what a lot of people note as like emotional eating or stress eating. And for some people, this can happen at the end of the day, or it could also be a grazing throughout the day. They can also engage in an opportunity binge. So this could be when they have privacy or alone time. It could be when they're driving somewhere and they're alone in the car. This is a way where people want to let loose with food when they can get away with it. There's also the vengeful binge, and this could be if they're feeling angry, if they're hostile, if they want to self-punish. And this could be directed at themselves, or it could be directed at other people, or even like diet culture or society as a whole. There's also a pleasure binge, which is for if someone wants stimulation or reward for something. And then there's even a habit binge. So this could happen if someone is at the end of the day always watching TV, and that's when they engage in binge eating. When they turn on the TV, they have the urge to binge eat, even if they're having enough nourishment during the day. So we have to break that automatic association. So just something to think about with your loved ones is, what do they really need in the moment, or what are they looking for in the moment, and how can you help them provide a different way to get what they need. And so I think it's important to talk about weight-based stigma and anti-fat bias. And for a lot of you, this might be the first time you're hearing these words or what this is. But it's important to note, because people who, like I mentioned in the earlier slide, up to 2/3 of people with binge eating disorder are in larger bodies. So they may experience weight-based stigma or anti-fat bias. But we all live in this society, and we all are affected by these beliefs as well. So it could be someone who's in a smaller body that doesn't want to gain weight because they're afraid of experiencing weight-based stigma or anti-fat bias. So I have two definitions here that I'll read of this. The first one is consistent systemic oppression against larger bodied people that makes it difficult or impossible to find clothes in spaces that fit, healthcare that's effective and non-discriminatory, equal access to employment, and other basic human rights that we all deserve. So people in larger bodies having difficulty just having their basic human rights met. Another definition of it is the social devaluation and denigration of people perceived to carry excess weight, which leads to prejudice, negative stereotyping, and discrimination towards these people. So the way that people in larger bodies are perceived in our society. Okay, so how can this affect your loved one? It impacts quality of care. So for a lot of people who are in larger bodies, they might avoid going to the doctors or going to get healthcare. And because they have experienced this in the past, it could be a healthcare provider telling them that they need to lose weight. It could be not being able to fit or sit in the waiting room. It's also important to note that our society does celebrate restriction and dieting, and binge eating is judged negatively. So again, that shame and stigma might come in, and they might not want to receive care. An important thing to note is that evidence does not support that higher weight causes health issues, nor that losing weight promotes health, but it's the first thing that is being discussed. So I'm not talking about health promoting behaviors here. I'm just talking about the number on the scale. People will see the number on the scale or someone in a larger body and make a judgment on their health, when you cannot tell what someone's health is like just by looking at them. What there has been research that shows is that someone who does engage in weight cycling, and so weight cycling is losing and gaining weight over time. That has been shown to have negative health outcomes compared to people who are at a stable weight, even if that weight is at a higher body size. And I think, again, this reminder that there's a range of body sizes for all eating disorders. A lot of people who have experienced weight-based stigma do not seek help or do not think that that they have an eating disorder, but they do. Okay, and so how might this show up for you in things that you might hear, or even things that you might think about your loved one? My goal by the end of this presentation will be that you'll be able to answer some of these questions or understand how they can be harmful. A lot of them, one thing that this may show up is in this question of like, but don't they need to lose weight? Or aren't they just out of control? Can't you just lock up the snacks? I'm sure a lot of you have heard these things or even thought these things yourself. And that goes to show the misconception around binge eating disorder and binge eating in general. Okay. So how do we shift this? And there's been a lot of research on the importance of having a weight neutral approach. And what that means is not focusing on weight. It's focusing on all these other aspects of health. And so we know that there's so many other things that contribute to a person's health, and that's what we're going to focus on in helping your loved one heal from binge eating disorder. One way to do that is to focus on improving their relationship with food. And this can be by removing moral judgments around food and following and learning how all foods can fit into their diet. It is to help build awareness of hunger and fullness cues. So, not only addressing the restriction component of it, so that's where the hunger comes in, but also addressing fullness cues and learning to be more in tune with their bodies. It's about emphasizing emotional and physical wellness over the pursuit of lower weight or size. So, like I've been mentioning, focusing on what contributes to their wellness. And that could be their mental health, it could be stress, it could be their diet, it could be a variety of other things, it could be where they live. And so, we want to make sure that we're taking care and addressing all of those things and not focusing on losing weight. It also is advocating for the removal of stigma experiences by persons with larger bodies. So, helping them advocate for themselves and helping you learn ways that you can advocate for your loved one. Some core components of this is intuitive eating and health at every size. And so I don't have time to go into those during this presentation, but it's just something to look at when you're looking at treatment facilities or providers for your loved ones, making sure that they're utilizing these approaches so that your loved one can get the best treatment and the treatment that they deserve. So why is this important? Um, there is minimal evidence for successful long-term maintenance of weight loss. So 95% of the people who engage in dieting or intentional weight loss will gain back the weight. And especially when we're talking about binge eating, this restriction component of intentional weight loss is just going to lend to more binge eating. There's dangers of weight cycling are so much more prevalent than the danger of being in a higher body size. Research has found that there is greater treatment engagement and lower dropout rates when a facility or a treatment provider is engaging in a weight neutral approach. So isn't that what you want? You want your loved one to be engaged in treatment. You want them not to drop out early. This can also help decrease shame and negative self-perception. So, like we've been talking about, shame is a huge component of binge eating disorder. And so, if we can help them decrease that shame and build up a positive self-perception, that will help decrease binge eating behaviors. It's also been showed to increase resiliency. And resiliency has always been shown to help to decrease mental health symptoms. So it's just important to note that there is benefits to a weight neutral approach and it has shown to have better outcomes. So at Within Health, we have some goals for treatment for someone who engages in binge eating. And I think it's important for us to go over here. So when you're looking for help for your loved one, you want to see and make sure that the place that they're getting help from is doing these things so that you could have the best outcomes as possible. So the first one is to reconnect to hunger, fullness, and satiety to guide their nutrition quality of life. So that's where the intuitive eating principles can come in. That's where decreasing that restriction part of the binge restrict cycle, decreasing the binge part of the binge restrict cycle, and just learning to enjoy food again. We also work with your loved ones on enhancing emotion regulation and self-care practices. So helping to decrease those emotional eating experiences by helping them develop other coping strategies and self-care practices. Um, we it's important for your loved one to understand weight neutrality and to increase their self-compassion and learn ways that they can empower themselves to combat anti-fat bias and diet culture. With all of our clients, we're working on gaining peace with food, body, and movement. And so I'm sure that's a goal for your loved ones as well. And then we also work on exposure therapy and recognizing restrictive mindset and patterns. So exposure therapy can look like them eating foods that they typically binge on in a safe way and incorporating them back into their diet in a way where they don't feel out of control around them anymore. and also challenging those restrictive mindsets and patterns by helping them eat more regularly throughout the day and get the nutrition that their body needs. I think it's important when we're talking about binge eating to also talk about trauma-informed therapy, because binge eating has such a negative connotation in our society, and that people who engage with binge eating could be treated in a way that is a form of trauma. So when I said earlier that it can take up to 10 years for someone who starts engaging in binge eating to seek care, to receive care, and to get an accurate diagnosis, in that time, in those 10 years and even more, they could have been put on restrictive meal plans. They could have been mandated movement. Their severity of their symptoms could be denied. And so all of these are trauma, and we want to make sure that your loved one's getting trauma-informed care for that. And again, that's where compassion comes in. So as you'll see through this whole presentation, we want to really focus on compassion and self-compassion. So some other treatment modalities for binge eating disorder, those are psychotherapy, structured self-help, cognitive behavioral therapy enhanced for eating disorders, interpersonal psychotherapy, and dialectical behavioral therapy. So these are just ones to keep in mind when you're looking for care. And so I'm not a dietitian, but I'm briefly going to touch on nutrition therapy and what that looks like for your loved one. So at its core, it's going to be education on consistent and adequate nutrition that will help break this binge restrict cycle. So decreasing restriction will help decrease binge eating. It's also going to help offer exposures and habituation to food that your loved ones might binge on to help them feel more safe around them and to feel like they don't need to binge on them. So decreasing that scarcity mindset. Also helping them develop more mindfulness and intuitive eating practices around food. Um, we know that binge eating can be a form of dissociation, so it can be a way for someone to numb out when they're eating. And so we want to help build up some more mindfulness around that. There's also a high co-occurring rate between ADHD and people with neurodivergency. That can interfere with binge eating disorder, and that can interfere with meeting their nutritional needs because they might be struggling with executive functioning. And so we want to help address that through nutrition therapy and to help them plan out their meals, maybe set alarms on their phone. That could also be like putting messages on whiteboards or paper around them so they have that around. Okay. And then we also want to address movement too. So for some clients, movement might be a way, they might be over exercising or engaging in movement as a punishment, or for others, they might be avoiding movement because of weight stigma that they've experienced when they've engaged in movement. So we want to make sure that we're addressing both. Um, we want to address movement avoidance and help your loved ones have shift into life-giving movement. So that can be by learning to move in ways that they feel joy in their bodies. We also want to work on helping them develop different modifications so that they don't feel like they have to engage in movement in a certain way that can feel punishing. And then also allowing space for there to be absence of pressure of movement and exercise. And that way that your loved one can help learn the joy in movement again and feel more empowered and do what they want to do, not what they feel like society might be telling them to do in terms of movement. So what is your role in all of this? How can you support? So one really big way is to not use stigmatizing language. Um, really helping to help decrease the shame around binge eating, helping with meal consistency. So that can be you modeling meal consistency. So you eating regularly throughout the day, eating with your loved ones throughout the day, helping them set alarms on their phone to eat throughout the day. It could also be emotional check-ins. So checking in with them on their emotions. How are they feeling? Noticing if they're starting to feel a little overwhelmed and maybe offering some more support during that time, helping them develop these coping strategies or reminding them of their coping strategies when they have a need to maybe engage in a binge. Holding compassion when they struggle. So to break the shame component of the binge restrict cycle, you have to model this compassion. And that could be whether it's you holding compassion for your loved one, it could be you holding compassion for yourself to model that too. In the next slide, I'm going to go through some ways to show some validation. And it's also important to treat everyone the same around food. And so we don't want to send any messages that your loved one who's struggling with binge eating has to eat food differently than everyone else. We want them to be able to build a relationship with food that feels safe and comfortable, just like everyone else. And we don't want them to feel like they have to restrict in any way. So, some things to be mindful of, ways not to support. We want to stay away from policing food, making any comments about food, talking about food being good or bad, talking about body size or weight in any way. We want to be really neutral around that. And I'll give some examples of that too. Okay, so what is validation? So, validation is a way to help people understand that you understand what they're going through and that you're there with them. So we do that through a couple different ways. So I'm going to explain it and then give you an example. So we start by attending. So that would be taking note of and observing body language and signals that your loved one's emotional cues. So you know your loved ones, you know how their body language changes, you know when they say certain things that something's off. So then what you want to do once you notice that, label it. So name it to tame it. Label the emotion that they're feeling or experiencing. And then you want to validate by conveying understanding, meet their emotional need by providing emotional support that can meet their emotional need for safety, space, comfort, or etc. And then help them problem solve. You can offer yourself, you can offer skills or distraction techniques. So let's say you notice that your loved one's feeling a little overwhelmed, or you're seeing body language that shows that they're typically overwhelmed in this moment. So what you can do is say something like, hey, I'm noticing that like you're looking a little bit overwhelmed right now. Are you feeling overwhelmed? What's going on? And if they say yes, then you can convey understanding. You can say, it makes sense that you're feeling overwhelmed right now. You're trying to figure out what to eat, and that can be a really overwhelming experience. And then to meet the emotional need and problem solve, you can ask if they want some help. So, could I help you maybe look at your meal plan? Or do you need help deciding through some options? Or you can say, what if we splashed some cold water on your face right now? Or if we took a break and got an ice cube to distract and then come back to figuring out what you want to eat? So, anything that works for your loved one is going to be different from other people, but just making sure that you are saying that you are labeling emotion that they're feeling and convey understanding of it. So, how do you build a healing environment? I've said a bunch of these things, but I just want to reiterate them. You want to reduce talk about weight, dieting, or good versus bad food. You want to make sure that their home feels safe for them. You can model attuned eating and self-compassion. So listening to your body, eating regularly throughout the day, talking to yourself in a self-compassionate way. You can help your loved ones emphasize their worthiness regardless of their body and behaviors. So providing praise for things outside of their body and their eating disorder behaviors. And then the slide that we just went over, practicing validation for your loved one's feelings. Okay, so now I'm going to go through some examples. And so these might be things that you might have said or thought about saying to someone. I mean, I just want to, like, I said this in the beginning, but as a reminder, like, no one's perfect. Important intent is important, but also impact, right? So you might have the greatest intent, but it might not land well, and your loved one could be really upset over it. So these are just ways to provide examples of that. And if you is something that you have been engaging in, make sure that you have self-compassion for yourself too. You're here to learn and to learn a different way. So something that you might say if your loved one's going for more food, are you sure you're still hungry? Your intent is to encourage mindful eating. That's what we're talking about. But how they may perceive this is that their eating needs justification, and it could also increase guilt or secrecy around food if they might think that you're monitoring them, and that's just going to increase guilt and secrecy. So a supportive alternative could look like saying something like, all foods are allowed here. You don't need a reason to eat. Your body knows what it needs. And so I think it's important to say your body knows what it needs because we're helping them look back into their body and listen to their body. So it's not saying like just eat whatever you want. It's also reminding them that their body's going to tell them what they need. So you might be thinking about how do you want to be healthy? You want your loved one to be healthy. So let's just do this together. Let's all just do a clean eating challenge together. Your intent is to bond with your loved one, to have some health goals together. But this idea of a clean eating challenge will just reinforce restriction and moralize food, which, like I mentioned, can just increase binge eating. So a supportive alternative could be, let's try to eat in ways that feel good and satisfying. No rules, just curiosity about what helps us feel our best. So again, focusing on satisfying foods, focusing on food that feels good, and just leaning into your body. So you might have noticed that your loved ones following their meal plan, they're doing really great with food. So you might want to like give them some praise and say something like, "You've been doing so good today. Go ahead and treat yourself." Um, your intent is just some positive reinforcement, telling them they're doing a great job. But this will link food with morality and it conditions worthiness and like you have to be worthy to eat certain food. So something else you can say is it's totally normal to want something sweet. Enjoying food is part of life. And so this will help get rid of that like good bad idea around food and to help normalize all foods. Something else you might have an urge to do to help decrease binge eating is to not keep the food that your loved one's eating is binge eating on in the home. So something you might say something like, let's not keep cookies in the house. They're just too tempting. But this will just reinforce the scarcity mindset and could increase binge urges because of that deprivation. So something else you can say is, we can keep all kinds of food in the house. It's okay to build trust with food over time. And what we want to be mindful of is this isn't saying that you have to keep every food in the house that your loved one's binge eating on, but you could do it in a way with support of their dietitian or their team, where maybe you do one food over time and start to reincorporate it back into the home until it feels like a safe food. Okay, so something you might say if you see that your loved one's reaching for seconds, do you really need seconds? And this, you might be fearful that if they get seconds, that it's gonna lead into binge eating, or you're even worried about their health because of body size or weight-based stigma. But this will just create shame and disrupt self-trust. So something else to say could be, take what you need, your body knows best. So again, helping them look back into their body and figure out what they need. Okay, so you might want to check in with your loved one and say something like, have you been sticking with your meal plan? A way to offer accountability and help. But this will just feel like a judgment to them and also reinforce perfectionism. So instead, you can say something like, how are you feeling about food and your body lately? Is there anything I can help support you with? So letting them know that you're there to help support and just checking in with them. Okay. A lot, and I think this is one that I gave in the beginning too, of just like, I'm just worried about your health. And a lot of times this equates body size with health and can feel like a criticism. And like I mentioned earlier, that you cannot tell someone's health just by looking at their body. So something else you can say is, I trust you're working on what feels right for your well-being, and I'm here to support you no matter what. So you want to help your loved one feel that you're going to be supportive and that you're not judging them for anything that's going on. A lot of times I also hear this where you're finding food wrappers hidden in your loved one's bedroom, or you're even realizing that food's missing from your house. So you might say something like, why are you hiding food again? This has to stop. You said you were working on this. And it makes sense. You might feel really alarmed and you want to address the secrecy and you're feeling overwhelmed, but this type of response will just increase shame and secrecy. So something else you can say is, I noticed some wrappers, or I noticed some food missing from the pantry. I just want you to know you don't need to hide food from me. I'm here to support you, not judge you. If something's feeling hard, we can talk about it together. It can be really healing for your loved one to start eating the food that they've been binging on in front of you and with you. And so that could be something you can offer too, of even like, hey, the next time you really want this food, how about we eat it together? That can be really safe and healing for them. Okay. All right. Well, right on time. Okay. So I know I covered a lot today, and it was more of like an introduction to a lot of things, but I'd like to open up for any questions.
Great. We have some good questions. Thank you, Carrie Ann. That was so helpful, so informative. We'll start with, what if your loved one is an adult and
Mhm.
isn't willing to seek any kind of help or treatment?
Yeah, that's got to be so hard when that happens. I think we can come at it through like that self-compassion and that place of how can you can provide self-compassion for that they're not willing to seek help. And you can be a support person for them in a way of being there for them, especially if like if they're isolating, maybe trying to reach out to them more, um, modeling eating throughout the day, modeling the behaviors that you think would be helpful for them to engage in, and just showing that you're there for them no matter what throughout the support.
Great. Thank you. And when you're treating eating disorders, are folks with binge eating disorder included in mixed diagnosis groups? That was one of the questions.
Yeah. So at within we do that. So we do have our clients all mixed together, and then we also have separate spaces if they'd like. So we have a process group for clients who engage in binge eating, and we also have different support tables for clients who engage in binge eating too. And they're also mixed throughout the milieu too as well. We find it can be
Great.
helpful to have them have experiences of both.
Great. Thank you. And we also have another question about, what do we know about the neurobiology of a person with binge eating disorder? Since we know eating disorders are brain-based illnesses, does
Mhm.
it look different than, say, someone who has anorexia?
Mhm. What we do notice is that it can look different, and it can also be similar too, because a lot of people who start out with just a diagnosis of anorexia can shift to binge eating because of what I was talking about, that binge restrict cycle. And so there is a lot of similarities between them. Some people see it as different, but I see it as the same thing. As a lot of people, as they recover from anorexia, will engage in binge eating because it's their body's natural response to restriction.
Yeah, that makes sense. Thank you. And then
Mhm.
do you have any advice, Carrie Ann, for if someone's loved one has celiac disease and has to eat different food, and it
Mhm.
makes them feel, it makes it difficult for them to eat with other people?
Yeah, that is really difficult. And I think that we see this a lot when people are recovering from eating disorders and they do have a true medical component that they have to restrict celiac, right? Or they don't feel well. This reminds me of intuitive eating and that idea of listening to our bodies. And so that reminder of, if they eat this type of food, that their body responds in a way that doesn't feel good, and to help support them through that. So you can work on like validation. Like, I know this is really hard to struggle with celiac and not be able to eat food that you want to eat, or to go out with friends and stuff like that. And then help them come up with different strategies that to cope with it. What can you do when you go out to this restaurant? Maybe look at a menu together with them. Just provide that support. And then reminding them like how much better they probably do feel in their bodies when they're listening to the medical recommendations.
Great, thank you. Our loved one is in a PHP program. Do you have any resources you can recommend to help us prepare for when they return home?
Mhm. Yeah, I would encourage, if you're not already, to be engaging in family therapy while they're at PHP, if that's possible, and to be a part of their treatment team. And then when they come home, a lot of the stuff that I talked about today, providing that compassion for them, talking to their team about what to expect too, and what they've been working on in treatment, making sure that you're a part of the team too, because you're gonna be their team when they come home from treatment. Um, I'm thinking making sure that you as a family are eating with them and following those like their meal plan with them so that they don't feel othered. Um, Talking about like the food wrappers example, if there is food that they're worried about eating or they didn't feel comfortable eating in the past, making those safe to eat in front of them, eat them in front of them, eat them with them, making sure that they really feel like all foods will fit for them when they come back home.
Great, thank you. Here's one. My daughter and I go food shopping together. She's an adult and she purchases her own food.
Mhm.
Sometimes she purchases items for a binge.
Mhm.
And she just is asking, is there any advice for how to react when she does this?
Mhm. Yeah. Yeah. I I think that's something to think about, especially since they feel safe enough to buy these foods in front of you. So it could almost like open the door for that conversation. Maybe I wouldn't do it in the moment, like at the grocery store, but maybe before or after you can talk to them about like, I notice how you've been buying foods preparing for a binge when we go grocery shopping together. Is there any way that I can help support you around that? So not making a judgment of it, just a notice. So that's where like the validation can come in. Um, and saying things like that. And then maybe she does want help with it, maybe she doesn't, and then you can go from there and see how you can be supportive throughout that process.
And this is something I was wondering too, and someone asked it in the chat. If you are offering that support, but your loved one doesn't want to talk about it, so
Mhm.
you continue to validate and offer the support, but they shut down at the thought of talking about it.
Mhm.
Um, what is a good strategy there?
Yeah. I wonder if thinking about what is helpful when they do shut down. So maybe they need to help regulating in that moment, rather than talking about it. And then you can come back to it. So if they're shutting down, is it helpful for them to go get some fresh air? Is it helpful for them to write in that moment? Is it helpful for them to maybe take a shower? Like whatever is helpful for them, and then coming back to it. I think sometimes we are fearful that if we don't talk about it right now, we're never going to talk about it. But it could be helpful to model that regulation in the moment and then coming back to the hard conversations. And maybe it's joining a therapy session or having a family session about it where it feels more safe and supportive to have the conversation.
Thank you.
Mhm.
Um, my daughter had anorexia and now has binge eating disorder, and she feels a lot of shame about it and isn't engaging with her therapist about it.
Mhm.
We're kind of like coming back around in a circle with similar questions. I know
Right.
it's really hard to manage these situations, but anything additional for that situation?
I think just even like validating that. I wonder what it would be like to have a conversation of like, hey, I went to this like parenting workshop on binging disorder and they said that this is common. So letting your child know that this is a common thing, more common than they think it is. We see this a lot in treatment where people come into, we call it like our beyond binging process group, where they feel like no one is talking about this. I must be the only one who does this, but it's so much more common. It's the most common eating disorder. So some psychoeducation or like education around that could be helpful. Asking them what they fear their therapist might say or do if they talk about it with them. And just asking if maybe it'd be helpful if you join a session and talk about it together. Just really like brainstorming different ways that you can support them while reminding them that this is the most common behavior and they're not the only ones who are engaging in it.
So kind of normalizing it a little bit.
Exactly.
Yeah.
Mhm.
Okay. And here's, I think, our last question in the chat box we have time for. How can we set healthy boundaries, treat everyone the same when the adult child eats all of something? It's hard to have a meal plan for the family,
Mhm.
which includes anywhere from a toddler to our adult child, and the adult child eats everything. And there's so much missing from the pantry and scrambling to try to feed my younger child. Do you have any advice for that?
Yeah, I'm sure that's incredibly stressful for you and for the family to figure out ways to address that. I think coming to your adult child and talking to them about it in like a normalizing way, about how I notice how when I buy things, like we've run out of them very quickly. Is there anything that we can do to help you with this? I would lean away from saying that they can only eat X, Y, or Z, but that's also really hard because like I'm sure it's a financial piece that comes along with it. And also just like not only financial, but like for the rest of the family, not living in a scarcity mindset, worrying that the food's going to go away. So really having an open conversation about it. And maybe it's when I think of habituation of food, of like reincorporating food, I don't usually start with all foods. So when I work with my clients, I start with like one or two foods, having that allowed in the house, and then have adding in more over time. So it could be of like not buying everything and only buying certain things, and then helping them feel more safe around them and eating them less over time, and then adding in other types of foods after that.
Great. Thank you so much. That was all of our questions and we're within time. So that's really good. It was so helpful to have this information about binge eating disorder. It's going to be a great resource for Feast to have. I want to also say thank you to Within for sponsoring this webinar and making it possible. And Feast really does rely on the generosity of our community to keep our programs and services going. So if you liked this webinar, or any of our other programs and services, our website has a place where you can donate. The link is right here on the slide. And we would really appreciate anything that you're able to give. And I would love to invite you all to our next webinar. It's coming up on Wednesday, July 16th, same time as this one. And the topic's going to be what constitutes good medical care for pediatric eating disorders, another really good topic. And thank you all for being here. And again, Carrie Ann, thank you so much for being here and giving us all of this great information today.
Thanks for having me.